Heliox therapy is a medical treatment that utilizes a mixture of helium and oxygen to aid in the management of various respiratory conditions. It has various essential uses in the field of respiratory care. We created this video to cover the medical definition and provide a brief overview of this topic. So if you're ready, let's get into it. As previously mentioned, Heliox is a gas mixture composed of helium and oxygen. Helium is present in the lower atmosphere in small quantities, but when mixed with oxygen, it forms a gas mixture with a density nearly 6 times lower than atmospheric air. This low density and high thermal conductivity make Heliox a valuable tool in respiratory medicine. Heliox gas mixtures are known to be non-toxic, non-carcinogenic, and have no lasting effects on any human organs. And you may be wondering, how does Heliox work? Well, as I said, the lower density of Heliox results in significantly lower turbulence, particularly in the more distal portions of the lung. This effect translates to a greater proportion of laminar flow and lower overall airway resistance. The decreased turbulence effect results in increased flow rates by up to 50% during Heliox inhalation. This decreased turbulence remains evident even when airflow is restricted, as in the case of obstructive lung diseases. Heliox gas has been used in a variety of clinical scenarios, particularly in the management of obstructive airway diseases. Some of the key applications include airway obstructions. Heliox was first used in the 1930s to relieve dyspnea in patients with asthma and laryngeal obstruction. Today, it is used in a variety of conditions that cause airway obstruction, such as acute vocal cord dysfunction, bilateral vocal cord paralysis, and intrinsic endotracheal and endobronchial diseases. Heliox has also been used to treat severe croup in children, resulting in significant reductions in croup scores and avoiding the need for intubations. Heliox has also been shown to reduce the work of breathing in patients with COPD, improving exercise performance and reducing dynamic hyperinflation. It can also be used to treat asthma. Randomized, placebo-controlled studies have shown that Heliox can improve clinical asthma scores in children with acute asthma. And Heliox has been used in conditions involving lower airway obstruction, such as pneumonia, bronchiolitis, and cystic fibrosis. Now let's talk about the Heliox composition. The specific composition of Heliox can vary depending on the clinical needs of the patient, but the two most common mixtures are 80-20 and 70-30. The Heliox 80-20 mixture contains 20% oxygen and 80% helium. It is often used for patients who do not require supplemental oxygen but could benefit from the reduced airway resistance and improved gas exchange that Heliox provides. The 70-30 Heliox mixture contains 30% oxygen and 70% helium. It is typically used for patients who require a higher concentration of oxygen. And remember, the helium in the mixture reduces the overall oxygen content, so Heliox should be used with caution in patients who require high concentrations of oxygen. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day. And as always, breathe easy, my friend.